here's a guy that's peeing all down his leg and cussing you out and going into a seizure in front of you at the desk, and all he wants is you to go back to the fridge and get him one more beer because that's the program he's on. And so I began to feel kind of like an enabler. Not kind of, a lot like an enabler. And that wasn't very comfortable feeling.
So let's talk a little bit about the work that you do. So you work in social services and you work on a van. Talk to me about what you do today.
What I do on the van?
Yep.
Okay, so Emergency Services Patrol is I just sort of a first responder. Our priority calls are police, fire, and emergency rooms at hospitals. And we deal directly with people who, well, various kinds of situations and people, but the primary purpose of the Emergency Services Patrol when they began was alcoholics, late-stage chronic alcoholics who frequent the same places in town, pretty much, same folks. We pick them up and transport them to the sobering center. Also, we take people who are in emergency rooms at hospitals to the Crisis Solutions Center so mental health professionals can work with them towards finding a baseline. We take people from emergency rooms at hospitals who have been connected with a social worker. Every emergency room has one. If you go in and you're strung out, maybe on fentanyl, maybe on whatever, doesn't matter the substance you're in, you want to kick, alcohol, they have a social worker in every emergency room that can connect you with a bed in a treatment center, so you can get either 3 to 5 day detox, let's say somewhere like Valley Cities, or a more lengthy inpatient treatment program at, let's say, Valley Cities or Turning Point, CMAR, and so on. So we transport, mainly what we do there is transport people who are with substance issues, mental issues, and sometimes physical issues. We have one wheelchair van and 2 other vans that are people. We work in teams of 2. We take calls dispatched by the police radio and a cell phone.
So when you first started talking about it, you said that this was originally, it originally focused on serving folks that suffered from long or late stage alcoholism. And so it's changed.
Yeah,
and
big
so
time.
how long have you been working in that?
6 years on the van. As an on-call for 4 or 5 years, and recently I got hired full-time career service.
Okay, and so over that 6 years, have you seen a transition or a change in what it is that you're doing? Or the people that you're serving and what you've seen in the community?
Definitely.
Okay, are you at
going down
liberty to talk about that at all?
Sure. Going downtown, we used to go to some very regular locations where usually my perception of where we usually would go is Victor Steinbrook Park, Beacon and Bayview up on Beacon Hill, or 3rd and Pike. And almost all the locations where we go were places where people would gather who were late-stage chronic alcoholics and could buy cheap and high in alcohol content, beer, malt liquor, whatever it is, and hang out together. And so that was where it was at when I began, which was 2018 on the van. So we would pick up people, and the sobering center at that time was a lot more, for lack of a better word, efficient. It was they had workers there from Reach, outreach workers, case management, and they had a building down there by the Recovery Cafe where people could, they were very regular and in and out, so the system wasn't really directing them towards real success, but they could get into real success in that getting sober, I don't think. I'm not sure what will help. It was all about harm reduction again. But they had a case manager that would get people in places like the Wintonia or 1811.
Which are wet buildings.
Which are
wet buildings. Do you want to talk a little bit about, because you worked in Wintonia.
Alcohol management programs,
okay.
So methadone for alcoholics, basically.
Right.
So yeah, I went to work, I think the first one was DESC. I'm not sure what year it was. Worked for them for a couple of years, and then into Catholic Community Services for another 2 or 3 years. Became a case manager, worked as a resident support staff in the beginning, became a case manager, left there, went to Lehigh, or Low Income Housing Institute, and worked with people, not a wet house, not an alcohol management program, because I had reached a point where I felt like I was enabling rather than helping. In the beginning, I thought I can help. I thought when I got a little bit of clean time, I thought I could help others get clean. I thought, like many of us do, I thought I could go into become a chemical dependency counselor and so on. And I had a friend that worked for DESC that I met at a meeting, and he said, "Why don't you just work where I work? You're not going to get paid any more or less. It's about the same kind of thing, except you get to help people on a one-on-one." And that appealed to me. And I was insecure that I could go back to school and get a degree in anything anyway. I didn't think I remembered enough math and so on. Pardon me. So I went to work for DESC in the beginning. The problem that I had with both 1811 and Wintonia, DESC and Catholic Community Services alcohol management programs, became that I felt like an enabler after a while. In the beginning, I thought it was an assist. I can help these guys through a hard time and that sort of thing. But also know that it was selfish to some degree, because working with folks on that level of desperation and or the disease and that depth of the disease has been conducive to my own recovery, because it brings home the fear that I have of ever going back to that point again. It's a daily reminder that that's where I could be so easily. And so it's not all benevolence that I worked there for, but after a while I did feel like an enabler, and I was more involved in 12-step program of Narcotics Anonymous. So it was like, on the one hand, at meetings and in step work and with the sponsor and in service work, we're talking about the therapeutic value of one addict helping another. And all we want to know is what you want to do about your problem and how we can help. And that, on the other hand, on my job, we have a refrigerator in the back. Here's a guy that's peeing all down his leg and cussing you out and going into a seizure in front of you at the desk, and all he wants is you to go back to the fridge and get him one more beer, because that's the program he's on. And so I began to feel kind of like an enabler. A lot like an enabler. And that wasn't very comfortable feeling. So eventually I left the alcohol management places, but
you stayed in the field.
But I stayed in the field, and the...
Do you feel like it's a vast field?
A vast
field of similar
I feel
approaches?
Like it's pretty vast. But I don't think that I felt much different in terms of whether it was alcohol management or just housing first.
Can you talk about that a little bit? What do you mean by that?
Well, I'll give you an example of what I mean by that. So I worked at Lakefront Community House of Lehigh for about 4 years from the time they opened. And so our original guests there, if you will, came out of the park behind it, Bitter Lake Park. These were people living in tents and out in the elements and so on, living in tents and so on. So the first people that came in there were from there, and it was kind of off the hook with the behaviors and all the stuff that went with it. And
I'm just gonna ask you to just tell me what you mean by that.
Well, I mean by substance and by the relationships and how so the
people that moved from the park that came into the building were on
not much changed.
And so,
oftentimes,
just for audience purposes, you have mentioned housing first. And so what is housing first?
Housing first, harm reduction is part of that whole harm reduction thing. If we get these the optics of people, a big part of this whole thing is even a blind man can see the optics aren't good. And when you go downtown Seattle, it's changed a lot since 1975 when I first came here. So we must do something about it. Is the thing you hear over and over again. We got to do something about this problem of homelessness. But it isn't just homelessness. And when I talked about being an enabler at the alcohol management, why it's similar when I went on to just a place with no alcohol program is that the same clients would get housing. And I started to give you an example.
And I interrupted you, sorry.
I'll give her a name. We'll call her, it's a fake name, Jane Doe. So we sent Jane Doe's been there for 2 years.
Yeah.
Our good friend that we talked about earlier had been there for 3 or so. So no change. No change is happening here, at least visibly. And so we get this one girl, Lehigh has a new apartment building. They send her to the new apartment. All she has to do is fill out the paperwork and stay there. Send her in an Uber over there. She turns around and comes back on a bus. I said, what happened? She said, I can't do that. I said, why not? I said, well, it's $50 a month for rent. How am I going to do that? And so the missing elements of what these places, nonprofits are trying to do with housing first is they're
housing first, just to go back to that. So housing first, and I'll just say it, is the idea that if you put people into housing first, then their life will improve sort of automatically, sort of a natural progression of improvement.
Well, I didn't say that
well,
automatically,
but that's what the policy says.
Yeah,
so that's the idea behind the policy. And I know because I have also worked in the field, but that is the idea behind the policy, that there will be sort of a natural progression toward an improved quality of life for the individual.
Right.
So,
however, what I have come to believe is that without assistance, for the person who has been living in a tent or an RV, or who has been in housing in a transitional housing environment for a while, the navigation from there to successful living within a community, in a social situation, and or to navigate the finances, the substance that I believe substance issues and mental issues are inherent with this homeless problem. And until you have somebody helping them navigate through all those things, they'll never get as far as successful living in the community and housing for very long, because the tendency appears to be to revert back to what you're comfortably uncomfortable with.
And so that brings up another question for me. So as a service provider in these different sort of similar but different substance-based housing programs that you're talking about, there's no training protocol for staff to work with individuals that are coming out of tents and off of the streets. And with that being said, what are typically the time frames that people have been on the streets? So because if a person's life is supposed to improve.
Let's talk about training protocol. The first, that was an interesting word, or a couple of words.
There's no kind of training, no kind of tutelage to support the individual coming off of the streets to help them progress.
Training for that person?
Yeah. So, for example, any kind of sort of skills training, because I'm guessing that people have been homeless sometimes for a period of time.
I don't know of any.
So having an expectation for a person to know how to navigate anything would suggest to me.
I thought you meant for the employees.
No. No, I mean the person.
I'm going to talk about that, yeah.
Well, we can talk about that too, but I'm talking for the individual that's coming out of the tents. I mean, are they being sort of, when they come into these housing programs, are they then entered into sort of a skill building process to help them navigate these things?
Not that I see.
Okay. Nothing that you've been trained to teach?
Nothing that I have seen, no.
Nothing that you've been trained to teach.
No.
So talk about the training for staff. You as a lay person that comes in and gets a job at a place.
Like I said, I work for DESC. These are large nonprofits here in the Seattle area.
So what does DESC stand for? Downtown
Emergency Services Center.
Yeah.
Catholic Community, CCSWW, Catholic Community Services of Western Washington, Lehigh, Low Income Housing Institute, and King County on the van. But the housing first harm reduction model is what seems to be is the popular mode for getting people off the streets these days. So I've worked for all of those. And no, the training is minimal for the staff.
How many staff that you've worked with in these environments come from the same kind of background as you? Do you find that most do?
Most, but not all.
Okay.
Yeah. Some are persons like yourself, somewhat in that they're in school. They're taking a social protocol, a social a regimen in school of some kind, and so it's a part-time job to kind of see where they fit in, learn more about it, whatever.
Yeah.
Most, I think, are people like myself, I'll own that have some background.
Or twins, by the way.
Who else has more compassion and empathy for somebody in that boat than somebody who has also been there before? So I think that it's appropriate that people have lived experiences that are working with people in that situation, for one thing. But most, but not all. It's the answer to your question anyway.
Do you feel like you personally could have made more of a difference had you have been able to kind of be more, I don't know if this is the right way to say it, sort of freelance in your approach? And what I mean by that is that I know that each position they have contract requirements associated with it based on what funders say for these organizations. And so did you ever feel like you could have potentially helped somebody improve their quality of life differently had you have just had the autonomy to do so?
Yeah, I probably did. I think I have. But that may be perceptual too. I don't know that I have. I think that I could help people, but not always are my thoughts right. I think that what they're doing is well intended. It seems to be well intended, but I think that every one of those organizations that I mentioned are mismanaged badly. I don't think there's enough training, and so they're not designed, well planned out, or designed, in my mind, to be successful at what their stated goal or mission statements are. That's what I think.
Yeah.
But what else do we do? It's, I don't know of anybody who's got a better plan. At the same time, I sure don't see the one that we are using being successful in the long run.
Are you aware of where the plans are coming from?
Probably not. I know where within one organization or another who the hierarchy of management. I understand that. I know where how it rolls downhill and so on.
Yeah.
Can
you talk a little bit about what you've seen change over the last few years? Just in the population that you're serving, for example, on the vans, what's changed in our service structure, just in your time in working in social services, and where have you seen the biggest increase in change? And do you think that the change has been positive when it comes to improving the quality of life for the individuals being served? So we'll start with, what have you seen change?
Yeah, well, the obvious big change that I've seen over time is this fentanyl, methamphetamine craze there, or whatever that's going on out there now. And so the drugs are different than, for example, when I or you were coming up, I think. Mm-hmm. And the effects are demonstrative.
Yeah.
And so before you can even talk about successful, healthy living or transitioning into housing in a community of any kind, whether it's even transitional housing, you have to look at that stuff, and I don't see that happening. So the positive changes, I'm afraid I can't say anything that feels very positive. I don't see anything in the equation that's getting better at this point. I see a lot of money being thrown at a situation with bad optics, and not a lot of effective resolution going on thus far.
Have you seen an increase in the population that you're serving, like on the streets and things like that?
Yeah, and it's different. Whereas the sobering van where I'm working now, the detox van or the drug buggy, the sobering diversion clinic that we go to, if you want to call it that, the people are the people that we're picking up are changing. Yes,
Yes.
It's not all late stage chronic alcoholics. Alcoholics are dying off. Alcohol tears up the body and brain in a different way, but those folks are becoming fewer. Is what I see, and what I'm seeing is we're passing by a lot of people who are digging around in the gutter over here for something that isn't there, or bent over in the corner in the doorway, and so we're not an outreach team,
Right.
and I don't see anybody, and it's difficult. There's no easy way to outreach with folks that are in that world that I can see. I found my first dead guy a few weeks ago. He was laying on 3rd Avenue South across from the Seattle Public Schools building.
The John Stanford building, yeah.
And had been there for a while. And I know that because I talked to the officers when we found him. We were about to drive by him ourselves. It
Like
was
maybe
3 in the morning.
Tapped out or something.
Yeah, he's another homeless guy.
Right.
Another homeless guy, another guy out there.
Yeah.
And so we were about to drive by, and we were dealing with another situation around the corner. And came around the corner, and here's this guy. And for some reason, my partner was driving. We work in teams of 2. I said, pull over for a minute. This guy, something don't look right. So we pulled over. I don't know what it was that was different that drew me, but I got out, and he was obviously dead.
Yeah.
From the moment I got out and looked at him, he had a red beard pointing straight up the sky, and his eyes were out here. And there were a pair of socks laying next to him and a couple of needle caps over here. So it was like almost as if this guy had just laid down to die. I'm going to do one and go, And I remember being like that, with that thought process going on at one point in my life. So that's what it looked like. Whether he died from a shot of meth, I don't know. I didn't see or hear of any other paraphernalia coming up when they found him or came to get him. Anyway, a week or 2 later, I asked the police who showed up there. We're at another situation like we came there for at the station around the corner. Yeah. And I asked them, what happened with that guy? Did you get the cause of death or anything from the ME yet? He said, no, we didn't get any. We don't usually get that, but what we do know is that he was there for a while.
Yeah.
Because there were maggots on the body.
Oh,
and
he had been there for a while.
He had been there for a while on a street where a lot of traffic goes by, and walking and driving.
Yeah.
That's a corner. It's like 4th and Lander around the corner. Mm-hmm. And so what struck me about that was that there's a whole lot of people out there that services aren't even getting close to, and I'm not sure how you do.
And that's a populated area. The John Stanford, which is the public schools building, is a very populated area. There are multiple people that are in and out of that building all day.
To the
and
McDonald's
there
and Burger
are, that's
King.
right, there are restaurants all
Shell
around that area.
Station is what we originally went down there for. We have a client that hangs out there, hangs out there disabled and drunk every day.
What do you think that speaks to? I mean, really, what do you think is happening to the public that guy sat that long?
Let's talk about that.
Yeah.
The navigation team, you remember.
Yeah,
went away.
Oh, it went away?
Yeah. Well,
the navigation team with the county or the city?
Well, who was it? It was the city of Seattle, I think.
it was city of Seattle.
And it was a
I thought you meant to
combination
reach.
of police and outreach workers.
So that team was disbanded when the defund happened.
Correct.
And they were typically the folks that would respond to all kinds of things.
Right.
The mental health
go out
needs
into the jungle where you don't want to go.
And when was that disbanded? Do you remember?
Right after the defund the police.
So in 2020 still.
I don't remember the exact date, but that sounds right.
Yeah.
And so then from that came a thing called the Hope Team. They're going to get the police out of it, and somebody else took over. And the Hope Team were reach workers from Reach, and or people who had been on the navigation team that just wanted it to go on somehow, and so on. So there were, but ever since, not ever since then, there has never been enough outreach, I don't think, to get to the people who need the services, who create those bad optics, that create this big homeless situation. They get to where the heart of the matter is. That's what I see.
So let me ask you this, and so I know this was the first body that you found. I don't expect it's going to be the last, just based on everything that's going on.
Right.
Through rumor and, colleague chatter, how much has death increased on the streets in Seattle that you're aware of?
Well, even before we get to death, let's talk about missing hands, missing feet.
I was going to talk about that with this new... all the new fentanyl coming in. I was going to ask about rotting limbs and things like that. Yeah. So let's talk about that.
Yeah, so I'm seeing a lot of that.
Okay. Are any of the folks that you're picking up
in wheelchairs? Yeah, we have one wheelchair van that the other van will call us if we happen to be the drivers in the wheelchair van to come and get a call that they can't take because they don't have a lift.
Okay.
So yes, we are picking up more people in, I believe, I'm not doing all the numbers or anything, but that are disabled.
Because they're losing their limbs.
Substance abuse, whether it be alcohol or whatever, is progressive.
Yeah.
And the age population is getting older out here. And so we're picking up a lot of disabled people, and the disabilities are oftentimes a combo. It's not just a missing limb or a... you remember you and I talked a while back about our friend. I saw him again last night.
Okay.
I don't want to get into names or anything, but this is a young man, right? Do you know who I'm talking about?
I don't remember exactly, but...
From the...
Oh, yes. Who was very vibrant and active, actually got out of prison, I think around 2014 or 15.
He's a double amputee now.
Yep, and then started using, kind of lost his mind, and then was all over the streets. He was functioning very well, was actually going to school, was really intelligent, and then just had a rapid decline. I do remember.
I just
and
got
now
another text from him last night after I saw him coming out of Harborview. Yeah. And then got a text from him afterwards.
Yeah, he is young.
He told me he was going to a meeting in Bellevue in case something happens.
Yeah.
I wanted you to know in case it, Anyway, so, yeah. The original question, are there more people out there? Is it different? Are there more people out there?
Have you experienced an increase in death? I mean, even amongst a lot of our friends, we share a lot of collective friends, and one person outside the other is dying of fentanyl overdoses.
Right.
So,
yeah.
Have you caught wind of fentanyl and tranq? Or apparently I've learned recently about something called gray death, which is just an accumulation of all kinds of...
I don't know. That sounds like a new one.
It is a new one, I think. Yeah, I think so. Somebody was reading a description of it.
But I've heard of tranq, and I've heard of... I've seen the fentanyl thing,
Yeah. All right. Well, if you could have a magic wand, and what would be different? How would... And I know that, sometimes people think it's an overwhelming idea, but how do you think that things could improve?
I think that if, I'm not sure how to change things on the management level, but when the legislators, whether it be at the state level, federal level, or city level, delegate money, there ought to be some sort of, like you said, follow the money. There ought to be some sort of accountability process better than what they have. Whatever has been happening isn't working. I think recently the King County Regional Housing Authority, they had a problem there, and so that they thought that was going to be life-saving change in the downtown area and so on. It hasn't, and the guy that was at the top was focused on as being some sort of nefarious guy. I'm not sure that he was, but that program came and went, like the navigation team came and went, and the mayor talks about doing a lot of things, but I don't see any of it happening. And maybe what I'm looking for is too fast of a change. You know, as an ex-addict, I like things to happen quickly, gratification to be immediate.
What have you seen under this mayor?
What, the mayor?
Yeah. Has there been any change? I know that I've come downtown Seattle and I saw all of a sudden all the homeless folks that were in certain places were then fenced out. So would you contribute that to
him?
Well, not necessarily him, because I do know that he pushed for it, but would you contribute that to solution or something else? And also, let me ask you this question before you answer that. Do you know what the number of folks living on the streets is right now?
No.
In Seattle? Okay.
I don't.
Yeah, so would you contribute that to solution, to people's positions in society sort of improving? All this fencing.
No, only optics.
It's only optics. Okay.
When you say the fenced off part, you're talking about the courthouse park or whatever.
There actually have been multiple places around the city. Yes, the fountain. There have been multiple, not just in the downtown corridor, but in sort of heavily trafficked areas in, I think, strategic locations. Yes, I've noticed that certain things have been moved out of those areas. And so,
do I see that as any kind of a solution?
As any solution has been involved in that.
Quick fix optics change.
Okay. Where'd they all go?
Around the corner to another place. Okay. You've been up to 12th and Jackson at all?
I have not.
By the navigation place up there, and the Native Indian Health Board.
Yeah, I know
up around 12th and Weller, 12th and King, 12th and Jackson. Well, 12th and Jackson, when I came to town, was rows back to back, people selling Ritalin and heroin.
Yeah.
That was the drug of soup du jour in 75.
Yeah.
And it was 2 blocks long of guys and gals selling hypodermic syringes and pills and heroin and Ritalin.
Yeah.
And 2 blocks of obvious bazaar going on out here. BA.
Yeah.
Bazaar. And now it's like a merchandise corner up there. It's been that way for a while. Now they've got a police car that sits there with the lights on because after dark it looks like zombie land up there and at 3rd and Pike and some of those spots.
Does the police car create a deterrence at all, do you think?
I think it does.
Okay.
But they don't go far.
Right.
It's like I said, they go around the corner.
Right.
And the guy in the police car seems to be okay with that. He's just trying to fix the optics on that one corner. Probably a sergeant or somebody told him, I want you to park there and put the fear factor up for at least for tonight.
Yeah.
Show.
How many people in the communities that are inundated with the population that's under the influence in Seattle, in your opinion, know that they're probably not going to be charged with anything? Do you think the people are pretty aware of that?
I do. I think that I think if one viewing of the nightly news will tell you that. Yeah. But certainly I think that everybody there, as an ex-criminal, and I think I'm an ex, and a person that suffers from the disease of addiction but is in recovery from that, I think that we're pretty hip and tuned into what the game go like this.
How policies are affecting us on the street.
Yeah, and what they're going to do or not do in a situation. Word travels fast in those circles.
Yeah. Well, I just want to thank you for your time, because a lot of what you're talking about is pretty near and dear to my heart, and a lot of my friends as well as yours.
And I know that, and that's why my time is your time anytime.
Thank you for it. No, a lot of our friends are the recipients of what's happening out here, and I think that telling these stories, the real ones, from the real people, I think are really important.
Hopefully something makes a difference somewhere down the line.
Well, we're going to keep telling the stories. Thank you, my friend.
All right.
I sure love you.
I love you too.